prevention. So in general, there is an evolution of heart failure that occurs in every patient, and that we can think of on the patient level and also at a population level as well. So when we think about the traditional risk factors for heart failure, they include aging, hypertension, smoking, high cholesterol, diabetes, obesity, various toxins, and for some patients, a genetic risk of developing heart failure. Ultimately, having these risk factors leads to myocardial hypertrophy, it may lead to infarction, death of myocytes, and scar tissue formation or fibrosis. This all leads to remodeling, including hypertrophy and chamber dilation or both. And that ultimately can lead to systolic or diastolic dysfunction. And as people transition through this evolution, we call the risk factors, or the presence of the risk factors for heart failure, stage A heart failure. Or you have a risk factor, but you haven't manifested the disease yet. Once patients have evidence of change to the structure of the heart, we call that stage B if they have no symptoms. And then once they develop symptoms, we may call that C or D, depending on the severity of the symptoms. And I think it's really important to note that patients who we think about in the industrialized world, there being, that's the reason for heart failure is obesity and sedentary lifestyles. But unfortunately, globalization that's led to industrialization and associated lifestyle changes are affecting pretty much every corner of the world, where sedentary lifestyles, obesity, smoking, and unhealthy diets have resulted in an epidemic of cardiovascular disease, so that even developing countries are seeing cardiovascular disease that was seen predominantly in developed countries, and that's contributing to a global rise in heart failure. So addressing these lifestyle choices and these lifestyle risk factors is critical for everyone. Again, just to reiterate the risk factors for heart failure: age. As age increases, the risk of heart failure increases. High blood pressure leads to a 2 to 3 times risk of developing heart failure, and coronary artery disease leads to a 2 to 3 times risk of heart failure as well. Diabetes raises that risk 2 to 5 times, and also the presence of valvular heart disease, obesity, and a sedentary lifestyle increase the risk of developing heart failure. If prevention of heart failure were easy just by eating right, not smoking, and exercising, no one would have heart failure. Unfortunately, these are challenges in every corner of the world as well. Getting patients to stop smoking, getting people who lead sedentary lifestyles to increase their activity levels, and getting people to eat healthily, sometimes in areas where healthy foods are not necessarily as available or affordable, are all challenges that as a global health community are critical that we address, because they are so very much so associated with the development of heart failure, artery disease, and other life-limiting diseases. So this is the simplistic way of how to prevent heart failure, but it's where we start. It's the foundation of how we can reduce the numbers of patients who suffer from heart failure.